Okay, so let's do another question. A 35-year-old woman with a history of endometriosis presents with ovarian tumor. IHC shows CD10 positive, inhibin positive, and keratinin positive. So we know these are markers for 6-cord cell differentiation. So it hints towards the diagnosis of adult granulosa cell tumor. Other options can be ruled out, and also presence of endometriosis highlights the answer could be the granulosa cell tumor. And in this case, often there is presence of increased estrogen symptoms with increased estrogen like abnormal uterine bleeding. Yeah, we know that in case of colorectal adenocarcinoma, it is often CK20 positive and CDX2 positive. Borderline tumors are often WT1 positive. Yeah, so let's do another question. A 16-year-old girl presents with ovarian tumor and hypercalcemia. IHC shows EMA negative, chromogranin negative, and WT1 positive. Most likely diagnosis is. So in this case, we can rule out neuroendocrine tumor because chromogranin is negative, and also hypercalcemia might direct us towards option A. In case of dysgerminoma, it is often PLAP and OCT3/4 positive, and also hypercalcemia is very rare in case of dysgerminoma, so it might not be the case. Granulosa cell tumor we have just studied, it is inhibin and keratinin positive, and also in this case hypercalcemia is not seen, so most likely diagnosis is option A. So now let's do another question. A 40-year-old woman with ascites has an ovarian tumor showing IHC keratinin positive, WT1 positive, and PAX8 negative. Most likely diagnosis is. So here, since PAX8 is negative, it rules out serous and endometrioid carcinoma. So option B and option C is ruled out. And since we have keratinin positivity and WT1 positivity, it hints towards mesothelioma, and also there is the presence of ascites. So adenocarcinoma are often keratinin negative, but may show TTF1 positivity. So yeah, mesothelioma is the answer. Let's do another question. A 50-year-old woman has bilateral ovarian tumors with IHC CK7 positive, CK20 negative, CDX2 negative, and GATA3 positive. So GATA3 points us towards breast or urothelial origin tissue. So by ruling out other options, breast and urothelial might be the possible answer. Endometrium and pancreas is ruled out. Other possible markers in case of breast can be ER/PR positive, but it is not given in the questions. ER positivity can also be seen in the endometrium, but GATA3 rules out endometrium. So in this case, CK7 positive and CK20 negative is the hallmark for breast cancer, breast tumors, whereas in case of urothelial, it shows CK20 positivity. So the likely answer is breast. So let's do another question. An ovarian tumor in postmenopausal woman shows IHC of inhibin negative, SF1 positive, FOXL2 positive, and CD56. So startled Leydig cell can be the answer, but it is often inhibin positivity, but it might also be inhibin negative in very few cases. Fibroma thecoma also shows SF1 positivity, but it is FOXL2 negative, so it might be ruled out. Granulosa cell tumor, similarly as in the case of fibroma, sarcoidotic cell tumor also are SF1 positive and FOXL2 negative, so this might also be ruled out. Granulosa cell tumor might be the possible answer because even if the inhibin is negative, SF1 and FOXL2 hints us towards granulosa cell tumor. And finally, metastatic small cell carcinoma is ruled out because it needs Neuroendocrine markers for diagnosis, like synaptophysin and chromogranin. So let's do our final question of the day. An ovarian mucinous tumor with infiltrative invasion and focal with PAC8 expression shows IHF CK7 positive, CK20 positive, and DPC4 is retained. DPC4 loss is seen in case of biliary, pancreatic, origin tumors. So option C can be ruled out. Since the question is thoroughly throughout, like uh, it is straightforward, that is, it is a mucinous tumor and also shows PAC8 positivity, and since both the CK are normal positive, then A could be the possible answer. Endometrioid cancers are often CK20 negative. Appendiceal carcinoma shows markers for GI positivity like CK20 and CDX2 positivity. So I think option A is the best answer.